Bismillah ar-Rahman ar-Rahim, my dear students of Ajman University. Today we are starting part 2 of Parenterals. We will start with or talking about milli equivalents and then about osmolarity. After that, we'll talk about tonicity as it relates to osmolarity. And once we finish that, we are going to talk about different methods of sterilization because, as you are aware, parenteral products need to be sterile and another additional requirement pyrogen free or pyrogen limited. Okay, let's start with the milli equivalents. Before we talk about it and how we calculate that, first we need to understand what do we mean by equivalent weight. Now, equivalent weight is the atomic weight divided by the valence or charge of the material that we have. I'll give you an example, and this is our reference. Hydrogen has an atomic mass or atomic weight of 1 and its valence is 1. Okay, so its equivalent weight is 1 gram of hydrogen, and actually this is our reference. Hydrogen is the reference material. If we look at oxygen, oxygen has an atomic mass or atomic weight of 16 and a valence or charge of 2. That's why it will give us 8 gram. Now, what does that mean? It means, for example, in H combining with oxygen or hydrogen combining with oxygen, 1 gram will be needed to combine with 8 grams of oxygen. 1 gram of hydrogen combines with 8 grams of oxygen. Okay, now what is this equivalent weight and milli equivalents? They are actually talking about the combining power and chemical reactivity. Okay, we know, for example, that we need two hydrogen or two atoms of hydrogen to unite with one atom of oxygen. But since we are talking about equivalent weight, then, and this is our reference, we need half oxygen in order to react with one hydrogen, and that is what we did in our calculation here. So the significance of milli equivalent and equivalent, what is the importance of that? It gives the ability or the combining power of atoms together. Okay, that's why one equivalent will combine with one equivalent. Yani one equivalent of an anion will combine with one equivalent of cation, and when they combine they give us one also equivalent من molecule. Okay, this is not like if you have taken molarity. Okay, it's not the same. uh, Equivalent, one equivalent reacts with one equivalent to give you one equivalent. Okay, this is how it works. So it's about combining. The significance of that is it can give you the combining power of materials. Now, uh, in our plasma, okay, there is about, in 1 liter there will be about 155 milli equivalent of cations and 155 milli equivalent of anion. And of course, طبعا, if we are talking about combination, because you cannot have cations more than anions, then the combination will give you 155 of these molecules in 1 liter. But of course, in the blood, these ions will be mainly dissociated. Okay, so if we go back to our example, this 1 gram is actually one equivalent. Okay, and this 8 gram is one equivalent. Okay, this is anion and this is cation. Okay, in pharmacy we are more, or it's more relevant to us when we talk about milli equivalent, because when we talk about equivalent, it's a lot when we say 1 gram and 8 gram. So if we want to talk about milli equivalent, then we can use this formula, and you have to memorize it in order to calculate the number of milli equivalent. And as you see here, the number of milli equivalent will be equal to the weight of the material in milligram. That's why it's milli equivalent. If it is only equivalent, then here we will have a gram. If this is only equivalent, then this will be gram. But we are talking about milli equivalent, that's why we have milligram. طيب, if we have milli equivalent per liter, then this will be milligram per liter. If we have milli equivalent per ml, then this will be ايش? milli equivalent per ml. طيب, so it's the weight of the material that we have multiplied by its valence. Okay, so you multiply the weight of whether the molecule or the atom that you have into the valence, and then divided by the atomic or molecular weight or formula weight. Okay, actually, if we just remove this one, okay, just say milligram divided by the molecular weight, okay, what you are getting is, and I hope that you have taken this in pharmaceutical analysis, you will get millimole. Okay, that's what you're gonna get, millimole. Of course, if you are talking about per liter, then you get here molarity or millimole per liter. Okay, طيب, that's why if you want the equivalence, then okay, what you do is you multiply by ايش الفالنس. That's what we are doing in the first equation. Okay, so again, first equation is actually millimole, okay, multiplied, okay, into valence. Or if I want to break it down, it's milligram divided by the atomic weight or molecular weight, and then you multiply it into the valence or charge of the atom. Okay, طيب, now if you want to convert milli equivalent to milligram, then you are using the second one. Of course, the second one, it can be derived also from the first one, and it's equal to milli equivalent, number of milli equivalent, multiplied, بدل divided, multiplied into atomic weight, and then you divide the answer by the valence. By doing that, you will get ايش? The amount of material in milligram. We are going to solve together one or two examples. Let's look at the first one. The first example says, how many milli equivalents of calcium are in 10 ml of 10% calcium chloride? Here is the formula. Okay, calcium chloride solution. The weight, the molecular weight for this formula is 147. We'll solve it together. Okay, is asking about first milli equivalent. Okay, so in 10 ml. Okay, so he needs milli equivalent in the 10 ml. So it's going to be equal to milligram, then remember multiplied by valence, and then divided by the molecular weight. Okay, that's how we're going to do it. طيب, do I have milligram? I can get it من ايش? From here. See, the concentration is 10%, right? 10% means 10 gram in 100 ml of solution. And this is the weight of calcium chloride dihydrate, and this is the solution. طيب, I need it in 10. So in 10 I will have x. If you calculate x by cross multiplication, you will get this one to be 1 gram. So in the 10 ml, how much I have? I have 1 gram of calcium chloride. You know that 1 gram will be equal to 1000 milligram. Okay, so what I do here, I use 1000 milligram, then I have to multiply it by the valence. I will talk about it, and then you divide it by 147. Okay, but what is the valence? Look here, look here. This water, forget about it because it's dihydrate, and it's not involved here in the charge. Here you have calcium chloride, here you have +2, and here you have 2 negative. So the number of charges, either you take the +2 or the 2 negatives here, because you have 2 chloride, so you have 2 negatives, or you have 1 calcium that is having 2 positive charge, and the valency will be 2. So this is how we do it, multiplied into 2. Remember that this one is giving you the millimole, millimole. Okay, طيب. Now let's do this with the calculator together. Okay, so we have 1000 multiplied into 2 and then divided into 147, and the answer will be 13.6. Okay, 13.6. What? 13.6? It's milli equivalent. Okay, so this is the answer. طيب, let's wipe out all these things. Okay, so we can do the second example. Okay, now what is the second example? It says, what does it say? It says how many milli equivalents of sodium are contained in 1 liter bag of 0.9% sodium chloride. طبعا 0.9% sodium chloride is the normal saline. Okay, normal saline is 0.9%, and later on we will talk about this normal saline. Okay, so zero point 0.9 means percent means there is 0.9 gram of sodium chloride in 100 ml of solution. So we are talking about 1 liter, يعني 1000 ml. Okay, so cross multiplication and you will get the answer x as 9 grams. So no, we know that there is 9 grams min sodium chloride, and you know that 9 grams means how many milligram? It is 9,000. Okay, we know this, it's 9,000 milligram. طيب, again, how many milli equivalent? Then I will have to write here milli equivalent per liter. Okay, because here it's saying per liter, and we know that in milligram we have 9,000, and then we need to multiply it into valence. NaCl, what is the valence? Okay, there is one negative and one positive, so either take one of them, so it's 1. Okay, and then divide it by the molecular weight of sodium chloride, which is 58.5. And what is the answer? How many milli equivalent per liter we have? We'll go to the calculator. and we'll divide 9,000 divided by 58.5, and the answer is 153.8. 153.8 ايش بده يكون ملي equivalent per liter. Now, where you're gonna encounter milli equivalent a lot, if you are using US literature in United States, they like to use milli equivalents in parenteral preparations when they want to talk about quantities. And as I said, the benefit of that, they will tell you about the combining power, chemical combining power of materials that you have. Uh, while in Europe they like to use millimole. Okay, that's why you should be familiar with both. Okay. طيب, I forgot to say something in the first example because it was asking about milli equivalent of calcium. But when we did the calculation, we got the milli equivalent for calcium ish chloride. Now, you should know that, as I said before, that the same milli equivalent of calcium chloride is the same as for chloride and the same as for calcium. They are all the same, will be the same thing. So whether calcium or calcium chloride, you have the same number of milli equivalent. طيب, now we will talk about osmolarity and tonicity. You know, the red blood cells, plasma, body fluids in general, they are compatible with 0.9% sodium chloride, which is the normal saline. It's compatible, which means that 0.9% sodium chloride and the blood plasma and red blood cells, they have same or similar number of particles per unit volume. Okay, you know that, for example, sodium chloride will dissociate, will dissolve and dissociate into sodium and chloride. These are the entities. Now their numbers will be similar to the blood plasma and to the whatever inside the blood cells. Okay, the number of these species will be similar, and we call them isoosmotic and isotonic. Okay, and this is the important thing that you should learn about 0.9% sodium chloride, is that it is isotonic with body fluids. It's isotonic. Not only that, but sodium chloride is used frequently to adjust the tonicity of parenteral preparations. It's very important salt, because you know our body has sodium chloride, and it's no problem to use it in IV fluids. Now, if the solution, okay, has less particles, يعني it's less than 0.9%, we call this solution to be hypotonic if it is less than 0.9%. And if it is more than, if it is more than 0.9%, then we call it hypertonic. Okay, hypertonic معناته hyperosmolar. Okay, وhypotonic معناته hypoosmolar. Now, there will be some problems, and we try to avoid these problems by adjusting the tonicity of parenteral preparations. See, for example, what happens if you have hypertonic solution with the blood cells, for example. Hypertonic, as I said, you have more sodium chloride. These NaCl are more. Okay? What is going to happen is water, as you will see here, and this is also showing the same thing, water will be going from the blood cells into the surrounding area in order to try and dilute the sodium chloride, to make it more dilute. Okay, that's why we call this solution to be ايش hypertonic because it's sucking water from the blood cells. And what happens when it sucks water from the blood cells? The blood cells will shrink. See, it will the cells will shrink and shrivel. Okay, راح ينكمش. They will shrink. If it is isotonic, then we don't have, or let's say the net movement of water outside the blood cells and inside the blood cells through the membrane, cell membrane, will be ايش the net movement zero. Okay, يعني there is no more water going out or more water coming in. هذا when I have an isotonic solution. طيب when I have hypotonic يعني the NaCl outside the blood cells are less. They are less. Okay, what happens in this case? Water from surrounding the blood cells will go inside the blood cells, and as you see here, it might burst. Okay, that's what could happen. See, cells swell and burst. Okay, that's why not only with parenteral products, even with ophthalmic products, we try to adjust age tonicity so that it becomes age isotonic. Now, osmolarity is related to tonicity. Okay, isoosmolar can be isotonic. Okay, because how do you calculate osmolarity? This is how you do the calculation. Okay, now milli osmol per liter هاي بنحكي لها osmolarity. Okay, milli osmol per liter is osmolarity, will be equal to millimole per liter. Okay, اللي هو milli molarity. If you remember, we talked about it before, and then you multiply it into number of species to which the molecule will dissociate. For example, in NaCl, it will dissociate to Na صح و Cl. So how many? Two. Okay, theoretically طبعا two usually, or practically it's 1.8, but theoretically it's two. Okay, for if it is calcium chloride, it will be 3, and 1 calcium and 2 chloride. Okay, so total will be ايش 3. So this is how you calculate osmolarity. So you want to try and have your solution osmolarity similar to biologic fluids osmolarity, which is approximately 285 milliosmol per liter. Okay, طيب let's talk more now. You have to differentiate between osmolarity, okay, اللي هو the number of milliosmol per liter of solution, the one that we discussed, and osmolality, which is, now pay attention to the difference, is the number of milliosmol per kilogram of ايش كمان, not solution, of solvent. Now for serum, okay, and body fluids, this is approximately 285 milliosmol per kilogram of solvent, which is approximately, because it's easier for us when we talk about per liter of solution, which is approximately similar. Whenever the solution is dilute, okay, the more dilute the solution, then osmolarity and osmolality will be essentially the same. Okay, طيب, so it's expressed as usually we express it as milliosmol per liter, and this should be about 285. That's why if your solution is from about 275 to 300 milliosmol per liter, we can consider ايش? We can consider the solution to be isoosmolar with the body fluid. But is it right to say every isoosmotic solution is isotonic? The answer is no. How? Okay, because all depends on the membrane. The membrane you see here should be a semi-permeable membrane. Okay, so it's to do with the membrane and also with the solute that we are talking about. Okay, مثلا where is the solute? NaCl, the solute. Okay, so it depends on the membrane. Okay, the membrane and the solute اللي هو ال NaCl or the drug itself. Now, if this membrane is only permeable to water, يعني only water can go out and in, but not the salt, not the drug. The drug cannot get inside the cell or outside freely. Only the membrane is a true semi-permeable membrane that allows only water to go in and out. Then in that case, the isoosmotic will be referred to as isotonic. Okay, but if the membrane allows the drug also to enter and comes out, then we cannot call the isoosmolar to be isotonic. Okay, طيب, let's go further into this and see how we can adjust tonicity in parenteral preparations. يعني let's say I'm preparing a drug of, let's say, ephedrine sulfate, and I need to adjust tonicity. How can I do that? Okay, now you should know that there are several methods, not one method, but the one that I like to describe for you is referred to as sodium chloride equivalent method, because sodium chloride is very well known. We know that 0.9%, okay, this 0.9% is normal saline, and we know that we adjust tonicity with sodium chloride. That's why they like to call the method here sodium chloride equivalent method. And essentially it tells you for any drug, okay, for any drug, 1 gram of this drug is equivalent to how much of NaCl in terms of tonicity. In terms of tonicity, the 1 gram equivalent to how much? Why? Because we already know that to have a normal or an isotonic solution, we need 0.9 gram of NaCl in 100 ml of solution. We know this. Okay, we should memorize it. That's why if I know 1 gram of the drug is equivalent to how much of NaCl in terms of tonicity, then I can adjust the tonicity with NaCl. Okay, and we're gonna solve the example here together, okay, in a simple way. Okay, see this example. It says how much sodium chloride is required to make the following prescription isotonic. Okay, type, it says that ephedrine sulfate you need to use 2%, sterile water for injection you need to make it to 30 ml, and you need to make it isotonic with sodium chloride. Okay, you will see here is given already that, for example, sodium chloride equivalent of ephedrine sulfate is 0.23. You know what does it mean? It means each gram of ephedrine sulfate is equivalent in tonicity to 0.23 gram of sodium chloride. That's what it means. Okay, طيب, we're gonna solve this one. First, let's divide it to two things. One, first I want to see how much I'm going to use from ephedrine sulfate. Okay, this is 2%. 2% means 2 gram in 100 ml, but you know that we need only 30 ml, so x cross multiplication, 30 into 2, 60 by 100, so you will need a 0.6 gram. Okay, طيب, now here You know that 1 gram of ephedrine sulfate, as you see here, this is given before, and if it comes in the exam, it will be given to you. So 1 gram of ephedrine sulfate is equivalent to 0.23 gram of a sodium chloride. This is sodium chloride, and this is ephedrine sulfate, ephedrine sulfate. طيب, you know that in this preparation we're gonna use ايش؟ 0.6, not 1 gram, 0.6 gram from ephedrine sulfate. So how much it will be equivalent to how much of NaCl? We'll do cross multiplication. 0.6 multiplied into 0.23 divided by 1, and it's equal to 0.138 gram. Okay, so the one I'm using is equal to 0.138 gram of NaCl in tonicity. Here I'm talking about tonicity. Okay, when I say equivalent. طيب, now if this preparation is sodium chloride, if it is not ephedrine sulfate, it should be ايش؟ 0.9%, right? If it is 0.9%, يعني 0.9 gram in 100 ml, then in 30 ml there should be how much NaCl? We'll put X. So 30 into 0.9, 30 into 0.9, and then divided by 100, and you will get point X equal to 0.27. Okay, يعني what I wrote here, if I want to do NaCl solution, I want only 30 ml. Then from NaCl I need ايش؟ 0.27 gram, and that will make the solution isotonic. Okay, because here it's not 100 ml, it's 30 ml. طيب, I already have in this solution, I already have ايش؟ 0.6 gram from ephedrine sulfate. 0.6 gram. I already have it in this 30 ml. طيب, this 0.6 is equal to or equivalent in tonicity. It's giving tonicity. It's equivalent to what? Here we did the calculation, and what was the answer? 1 gram 0.6 X. What was X? Where did I write it? Okay. X here is 0.138. So I have كأنه, if with the drag, it is like I'm having 0.138 gram of sodium chloride. يعني the effect of the drag, if there is no sodium chloride, nothing. The effect of the drag in tonicity, it's like 0.138 gram of sodium chloride. But you know that to make it isotonic, sodium chloride should be more. And this is what we want to do. We want to see how much the total sodium chloride tonicity should be there. It's this one. And how much is represented by the drag? This is represented by the drag. Tonicity represented by the drag. Okay, it's 0.138. What is the difference? That's what you need to add. So 0.27 minus 0.138, and that's how much sodium chloride. Then 0.27 minus 0.138 is equal and the answer is 0.132 gram. يعني in order to prepare this recipe, okay, one, I need to get 0.6 gram of the drug اللي هو الإفيدرين sulfate, add to it 0.132 gram of sodium chloride, and then make it up to 30 ml to have an isotonic tonic solution. Okay. Okay, let me just remove these things. Because now we will talk about sterilization. Okay. طيب, in sterilization, you need to know that we have, or we're gonna discuss 5 methods for sterilization. What are these methods? One, اللي هو steam sterilization, then dry heat sterilization, filtration, gas sterilization, and the last one, ionizing radiation. Now, for steam sterilization, it is the method of choice whenever the material allows. Okay? For example, if the material can withstand temperature, high temperature, then we will use, for example, steam sterilization. If it can withstand the steam, then we will use the steam sterilization. It is the method of choice. It's preferable than dry heat because it's more lethal, okay, and more effective than dry heat. The presence of steam, okay, steam itself, the water itself, has an effect on microorganism. It causes coagulation of microorganism, denaturation and coagulation quickly, and that explains why the spores of bacteria, they are more resistant than the bacteria. Okay, the spores are more resistant. Why? Because they are drier. That's why steam itself, the water itself, will give or will improve the lethal effect of steam sterilization. The equipment we use is referred to as autoclave, and autoclave means self-closing. It closes by itself. Okay, these are with the old equipment where the pressure generated from the equipment will cause the closure of the autoclave. That's why they call it autoclave. Now they use higher pressure. Okay, يعني they increase the pressure using this autoclave in order to be able to attain ايش higher temperature. Because if you attain higher temperature, as you see here, you will be able to reduce the time needed for sterilization. Commonly they use the temperature 121.5 for 20 minutes, but even this time can be different from, or there can be difference from some items, like for example you are dealing with bulky solution or small solution, etc., how they are packed inside the equipment. All of this will affect the time. Okay, but let's say that steam sterilization is the method of choice. We increase the pressure in order to attain higher temperature and therefore less time. طبعا we don't want to go higher up the temperature because this might also affect the materials that you are trying to sterilize. Okay, now what are the usual materials you sterilize with autoclave or with steam sterilization? You can sterilize solutions in sealed container, يعني in closed container, like ampoules. Okay, you can also sterilize bulk solutions, glassware, حتى surgical dressings, clothes, instruments. You can sterilize them using steam sterilization. The other way اللي هو dry heat sterilization. In this case, you will need to raise the temperature to 150 to 170 degrees Celsius for not less than 2 hours, not less. Okay, uh, as you see, it's less effective. يعني from the temperature, okay, you see that it's less effective than steam sterilization, and the killing of microorganism usually happens through dehydration and slow oxidation. Okay, it dries up the water from the microorganism and starts to destroy the microorganism by slow oxidation. Now, you cannot, for example, sterilize fixed oil. You cannot sterilize them in steam sterilizer, but you can do that in dry heat. In dry heat, you can sterilize fixed oil, glycerine, various petrolatum like mineral oil, paraffin, soft paraffin, and heat stable powders like zinc oxide. You can sterilize glassware, surgical instruments, and it will be considered, or it is considered, the method of choice when you are, for example, your instruments or apparatus are wet and you need them to be dry. فإذا you are utilizing the heat, dry heat sterilization to dry the instruments and sterilize it. Okay, that's why dry heat is the method of choice when the apparatus or dry containers are required. Filtration is the third method that we want to talk about. Now, filtration in many cases can fail compared to other method of sterilization. That's why you need to give more attention to this method. And filtration is different because you don't destroy microorganism. What you are doing, you are removing them physically. So not destruction, but removing physically. This can happen by two methods. One is through adsorption, and the other method is through sieving. What you are seeing here, sieving. If the particle is small and gets stuck somewhere in the passageways, in the channels, then that is adsorption if the particle is smaller than the opening. Okay. Now, Millipore is a company. Their filters are well known for the sterilization purpose, and it is a thin, it's called thin plastic membrane made of cellulosic ester. Okay. And the nice thing about this membrane, it's thin. Okay. That's why the removal happens on the surface, يعني by sieving. Okay. لأنه في عنا other membranes which are thicker. It might be removed by adsorption or and by sieving. Okay. The nice thing about cellulosic ester membranes that their surface has 80% holes. The pores occupy 80% of the surface. This is good and bad. The good thing, it will allow adequate flow rate through it, so you can filter easily through the membrane. The bad thing is that this membrane needs support. Okay, it's very thin. It has many holes, many pores, so it can break easily, and any mistake or any problem can allow the microorganism to pass. The type of membrane the size of the pores in this membrane usually that we use for sterilization is 0.22 micrometer and 0.45 micrometer. These are the filters that we usually use to remove microorganism. You see here you have a syringe, and to that syringe attached through lure lock. This one, the one that you rotate into the syringe, is referred to as lure lock. Okay, so this filter assembly here is attached to the lure lock, and you can use it to draw materials through the filter. So this is a way of filtration. Then when you want to use the sterilized or the filtered liquid, you can remove this filter, and then you can add it to a container using aseptic technique. Now, aseptic technique is very important to make sure that after you do the filtration and you remove the microorganism, you are not contaminating something else. Okay, or you don't get contamination from somewhere else. For example, if you are taking the preparation by this syringe, you are taking it, you adding it to a container, glass container. This glass container should not be contaminated. It should be also sterile. Otherwise, you are losing the benefit of removing the microorganism. Here, what you see here is the filter assembly, and you see here the support, because you need to support the filter. Okay, and you need to make sure that the assembly is working well, and there is no for example gaps, or the filter is damaged or something like that. You have to make sure of all these things. طبعا it's the method of choice اللي هو sterilization by filtration. It's the method of choice when you are dealing with small volume of solution, because if you have small volume of solution, you don't want to go and do the autoclave with this small volume of solution, or do dry heat, which is maybe not the correct thing to do. Okay, so filtration will be the method of choice if the item you are trying to sterilize is a small volume of solution. The other way to sterilize is through gas. Okay, and the gas that is used for sterilization is either ethylene oxide, and this is more common, or propylene oxide gas. Now, for ethylene oxide, sometimes they abbreviate it as ETO or EO, ethylene oxide gas. And if you are in the pharmacy, some of the syringes in the pharmacy, if you look at a syringe, maybe not all of them, but some of them, look at them, read, and they will tell you ETO sterilized, means sterilized by ethylene oxide. The problem with these gases, they are highly flammable when mixed with air. That's why when we want to use this gas, we use, or we dilute it with carbon dioxide or other suitable fluorinated hydrocarbon to the reason to prevent the risk from this highly flammable gases. Okay, in order to improve the efficiency of these gases, we can do two things. One, increase the humidity. Okay, for example, we can raise the humidity up to 60%. The other thing is increase the temperature, but we increase it up to 50 or 60 degrees Celsius. We don't want to go further, because using the gas sterilization, we are trying to reduce the risk of the degradation for the drugs, okay, because of heat. Okay, that's why we don't want to go very high. We go up to 50 or 60 degrees, and the humidity is up to 60%. And the usual sterilization period ranges from 4 to 16 hours. The beautiful thing regarding this gas sterilization is that you can do the sterilization just before shipping the catheters or needles or plastic disposable syringes to the shipping them to or distributing them. Okay, you can do the sterilization. The beautiful thing that this can be done in their final plastic packaging. يعني these syringes that you see in the pharmacy, which are sterilized by ethylene oxide, have been sterilized while they are in their final package. Okay, and this is something good. Okay, and how they are able to penetrate the package, how ethylene oxide is able to penetrate the package, is because these gases are highly penetrating gases. They are not like normal gases. Okay, they are highly penetrable gases. They penetrate and diffuse in very strong way. Okay, that's why we can use them also for heat labile enzymes and drugs like antibiotics uh, and any drug that is thermo or heat labile. Okay. The fifth method is sterilization by ionizing radiation. These radiation are very strong, they are very effective, but they may have problems. We have the gamma rays and cathode rays. Cathode rays, they are a beam of electrons that are focused on the items that we are trying to sterilize. Okay. Now, the facilities for gamma rays and cathode rays, you cannot see or find these facilities everywhere, and also they may have or they may damage your items during the sterilization. They may damage the container, they may damage the product itself, the drug itself. That's why it has limited use. Okay. Now, okay, sterilization is very important. You learned that. You learned the different methods of sterilization, but you need to make sure that your process, the sterilization process, is effective and it's giving you a sterile product. Of course, you need to check your product whether it is sterile or not. Yes, there are tests for that. But also, you need to check whether the process was successful, okay, or not. And to do that, one of the ways is to use a biologic indicator. Okay. يعني when we are doing the sterilization process, we add this biologic indicator, we add it in the equipment which will carry out the sterilization, and then we look at the biologic indicator whether it survived the sterilization or not. طبعا if it doesn't survive the sterilization, then you are ايش or your sterilization process is effective. If it survives, then there is a problem. Okay. طيب, what is this biologic indicator that we use? We use spores of microorganism that is most resistant to that particular sterilization process. Okay. For example, you see with this photo, if I'm sterilizing by radiation, okay, for by radiation, then I will use the spores of this microorganism. If I'm sterilizing by steam or by ethylene oxide gas or dry heat, then I can use the spores of these microorganisms and so on. So why these microorganisms? Because they are the highly resistant to this sterilization process. If these spores do not survive the sterilization process and they are highly resistant to them, معناته I am validating and I'm making sure that my sterilization process is effective or was effective. Now, how biological indicators are added في الsterilizer? How do they add it? They are adding it as you see here in like a filter, a strip, okay, in a filter that allows the sterilizing agent to get in. Okay, it allows that without destroying this packaging. Okay, this is one way. So spores are in a strip in a filter, okay, that allows the sterilizing agent to get inside without damaging the package from outside. طيب, the other way is to add the spores, to add them to representative samples. Okay, if I have samples, okay, containing liquids, to some of them I will add the spores. طبعا I will mark them clearly. And after the sterilization process is complete, then I will test these representative samples. Okay, the samples I marked that they contain the spores, I will test them whether the spores survived or not the sterilization process. If I'm adding them as strips, as you see here, then in this case I will test the strips to see if they have surviving spores. طبعا there is also chemical ways, okay, that we will not talk about it in parenterals now. Okay, there is, in addition to biologic indicator, we have ايش the chemical indicator. طيب, so what happened today, or what happened in this part that I discussed so far? One, we discussed about the sterilization process and how the sterilizing agent kills the microorganism or remove it. For example, في الethylene oxide, it interferes with the metabolism of the microorganisms inside the microorganism. With the ionizing radiation, it affects the chromosomes, it affects the chemical inside the microorganism. With steam heat, we said that it coagulates and denaturates the microorganism. With dry heat, we said it dehydrates and slowly oxidate the microorganism. طيب, and we talked about sterilization, but there is another important thing, is the need to do depyrogenation and test to make sure that there are no pyrogens. The main source of pyrogens, as we discussed before, اللي هو bacterial endotoxins, and these come from the outer cell wall of gram-negative bacteria. And this outer cell wall of gram bacteria has a natural mixture of lipopolysaccharide. Okay, so if there is lipopolysaccharide, we need to know that this means that we have endotoxins. Okay, now pyrogen limits, according to United States Pharmacopoeia, should not be more than 5 endotoxin unit per kilogram of the patient. That is for parenteral drugs, but for intrathecal, okay, when it goes to the brain or spinal cord, it should not exceed zero point 0.2 endotoxin unit per kilogram. Okay, now how do we remove it? Okay, there are different ways. One, and this is the most frequently used way, اللي هو through oxidizing them. يعني I take the distilled water, several times distilled water. Okay, now I want to remove pyrogen from this distilled water. So what I do, I add potassium permanganate and barium hydroxide. The potassium permanganate is the oxidizing agent. Barium hydroxide is to make the process more efficient. So I add them, and then I do several distillation until I get rid of potassium permanganate and all other materials, until I get rid of them. Okay, your product will be ايش free from pyrogens. إذن by oxidizing. Number two, by dry heat. If I have, for example, a glassware and I want to remove pyrogens from them, then I can heat them to at least 250 degrees Celsius, at least, for at least 30 minutes. طبعا here 45 minutes, at least 30 minutes. The other way is through filtration, but not the normal filtration that we do sterilization with 0.22 micrometer, because they will not be able to remove pyrogen. It has to be much smaller. Okay, these are the ways to remove pyrogens. طبعا also, if you have a container, you can wash it. If you have, let's say, water that is free from pyrogen, you can wash this glass container with water that is free from pyrogen, and your container then will be free from pyrogen. But how do we test whether there is pyrogen or not? Now, for pyrogens, okay, there is a test in the United States Pharmacopoeia اللي هو rabbit test. في عنا another test اللي هو endotoxin test, which is referred to as lamellus amoebocyte lysate LAL test. Okay, this LAL test, okay, is very sensitive. Unlike rabbit test, is very sensitive, but the thing is it measures, or it records, or it allows you to know how much endotoxin units are there. And if you remember earlier in part 1, I told you that pyrogene, yes, the main source of pyrogene is endotoxin, but there are other materials that can cause pyrogenation, or can cause increase in body temperature, and can cause hypotension, etc. Okay, is an endotoxin is the main source for pyrogens, but it's not the only one. Okay, yes, we don't expect anything other than endotoxin, but it can be. If you want to test for pyrogen, then it's the rabbit test that you need to use. But if it doesn't matter, or if it is allowed, then it's better that you do the LAL test, Lamellus amoebocyte lysate test. Okay, because this is more sensitive, but as I said, the negative thing about this test is that it only sensitive to lipopolysaccharides اللي هو الانdotoxins. Okay, طيب, now what is, or how did they come up with this LAL test? They get it from horseshoe crabs. You see here, okay, the horseshoe crabs, and they get the enzyme from them, and they found that this enzyme that you see in the bottle, with very small quantity of endotoxin, it solidifies, okay, or becomes viscous, or becomes turbid, and they used that in order to develop the Lamellus amoebocyte lysate test, which is very sensitive to endotoxin. أما في الرابت test, which is for pyrogens in general, they take rabbits. طبعا I will explain it very summarized way. They take 3 rabbits, and then they infuse in their ears, infuse 10 ml per kilogram of rabbit, 10 ml of the drug solution, and then they see whether the temperature of the rabbit will increase or not. طبعا there should be no or little increase in the temperature of rabbits. Okay, otherwise they need to use additional rabbits, and يعني the test is long. So essentially there should not be a high increase في temperature of rabbits after administering in their ear veins. تعرفوا rabbits, they have large ears, and in that you can see the veins. So when you test, you administer 10 ml of the drug solution in the veins of the rabbit per kilogram, and you wait and you start measuring the temperature to see if there is a rise in temperature of the rabbit. Okay, if there is rise, that indicates there are pyrogens. Okay, there is pyrogen in the solutions you injected. Okay, now when you want, or when the industry they want to prepare parenteral products, they have to think about the solvents. As we explained before, the solvents should have the right characteristics, sterility, ability to sterilize them, and we should think about what other additives that we need to add, which might include buffers to adjust the pH, preservatives. This is with multi-dose containers, stabilizer, so that for example antioxidants or solubilizers, and agents like sodium chloride to adjust tonicity. Okay, we should also pay attention to the environment for industry, as we have to operate under aseptic conditions, in order not to allow contaminations to get into our area of working. Okay. We should also determine what sterilization method that we are going to use. Are we going to sterilize material and then combine them, and then we get the sterilized product, or we mix the product and then put it in the package and then sterilize it? We have to think about all these elements. Another thing which we already talked about before is that if the powder that we have is for reconstitution, in this case we usually prepare the powder using freeze drying or lyophilization. And we said that the reason for that ايش هو, it will be easily reconstituted, or the powder will be easily reconstituted, because the property of the freeze dried material is like a sponge that allows the liquid to penetrate it easily. Okay. Now, usually the vehicles we use for reconstitution, the most frequently used vehicles are sodium chloride injections. Okay, and whenever we say injection, we said it means it's sterile, except when we are talking about water, then we have to mention whether it's sterile or not. Okay, so the most commonly used sodium chloride injection and sterile water for injections. طبعا, what is the problem? When you want to add a vehicle, for example, let's say you have a vial. Okay, here you have rubber closure, and then you have a syringe. Okay, and you are getting sodium chloride from one container, and then you are transferring it here. All of this gives risk. There is a risk of contamination. Okay, and that's why some companies, and including Pfizer, which is the biggest pharmaceutical company, they have preparations where the system is ready to mix. Okay, ready to mix, like what you see here, ready to mix. Okay, what you see here, the water that you want to mix, or the vehicle you want to mix it with, the powder is already there. You just press on it and it will fall down, so you are reducing the risk of contamination. This is referred to as mix or vial. اما EDD Vantage System اللي هو شركة هوسبيرا, and Hospira company is for Pfizer as well. It's for Pfizer, so we are talking about Pfizer, has the ADD Vantage system, which is another ready to mix sterile IV product. شوفوا, here you will have the powder, and here you will have the liquid, and there is a mechanism by which when you want to use it, you can open it from here, and then it will allows the mixing to happen. Now, regarding the packaging, we have to pay attention that the container and closure should not interact with the product inside. Also, it has to be transparent. Okay, it can be amber color, but you should be able to see through. Okay, why? Because always, and remember this, before you do the injection, you have to inspect visually the container. If it should be clear, then it should be clear. It should be uniformly cloudy, then it should be uniformly cloudy. Okay, so it should allow you to inspect. Now, single dose containers, يعني for a single dose, can be in the form of ampules, and this glass ampule will always be from glass type 1. Okay, because there are 4 types of glasses: glass type 1, glass type 2, glass type 3, and glass type 4. The one that is most resistant اللي هو glass type 1. It's resistant to chemical degradation and leaching. It's the best one, and it's used for ampules. Yes, glass type 2, which is less resistant, glass type 3, which is even lesser resistant, can be used, but for ampules only glass 1 is used. Glass 4 cannot be used in pharmaceutical preparation, glass type 4. Now, which container, which glass type do I use? It depends on the pharmacopoeia. I have to go to the individual monograph and find out in the United States pharmacopoeia what type of glass or container should be used for that product. إذا single dose containers include ampoules, include single dose vials, كمان pre-filled syringes or cartridges. Okay, like what you see here. You take the cartridge and you put it in a holder and then it's used. This is ampoules. So these are the type of products. This is the ampule. Most ampules, as you will see here, has a dot here. Okay, this is the body, this is the dot. Okay, this is the neck. Okay, and this is the conical tip. Now this dot is important because beneath it on the neck there is a score, يعني حز. In order, طبعا why this dot is there is to tell you that beneath there is the score, and that's the point where you need to press or apply pressure in order to break the ampule. What you see here is the sealing of ampule. Ampules are sealed with heat. Okay, this is what happens here. Okay, so the tip of the ampule, this tip, okay, راح يكون في هناك heat, and this heat will cause the ampule to close. See this one, this is open. Okay, so with heat it will close. طبعا after closure في هناك a place where anything extra will be cut or removed. طيب, single dose containers should not allow the withdrawal of more 1000 ml. إذن what is the maximum volume for a single dose container? The maximum volume is 1000 ml. Also, filtered air and directed airflow should be used in the production area. Why? To maintain the aseptic condition and to reduce the likelihood of contamination. Personnel should be trained on aseptic condition, and they should not only be trained and have the skills, but they should understand why they are doing what they are doing. And the chapter in the United States Pharmacopoeia that is enforceable and must be followed to when you are preparing sterile preparation is USP 797. Memorize this chapter, okay, because it talks about pharmaceutical compounding of sterile preparation, CSP. Okay, CSP, compounding sterile preparation. Don't forget that you always need to do inspection. Inspection can be done visually or by the use of a machine like Coulter counter. Multiple dose container, these are vials with rubber closures affixed on them. Okay, يعني on the closure is made of rubber. Why it's made of rubber? Because it will allow the needle to be inserted and the dose to be withdrawn, and after removing the needle the closure will reseal. Okay, it will reseal because it's rubber, and then it will allow you to do it again. And as you know, if we are talking about multiple dose container, then it must have a preservative. Okay, and شوفوا احنا حكينا في السنجل دوز it can be up to 1000 ml، بس شوفوا بالمالتيبل دوز container should not be more than 30 ml or 10 doses. Why? Because if you keep continuing withdrawing from the multiple dose container, you are increasing the risk of contamination every time you are withdrawing. Also, don't forget that we don't want by mistake someone comes and inject or infuse a large volume of from the multi-dose container containing the preservative. You don't want this to happen, okay, by mistake, and then a lot of preservative get inside the body, okay. That's why it's limited to 30 ml or 10 doses. As we explained before, we always add extra volume in order to withdraw the required quantity, okay. Labeling. Okay, as I said, no need to add the word sterile except when we are talking about water. So any injection is sterile. Another thing which we already talked about, when the label says injection, it means it's a solution. Injectable suspension, I'm talking about suspended particles. Injected emulsion, we are talking about an emulsion preparation. But if the preparation has solid for reconstitution, then it can be either for injection or for injectable suspension. طبعا we talked about all these when بالfirst part. Also بالlabeling there should be the name of the preparation. Also, if it is a liquid preparation, the percentage of the drug or the amount of the drug in the specified volume must be mentioned. If it is dry preparation, then the amount of active ingredient and the liquid and the volume of the liquid should be mentioned. The route of administration should be mentioned. Is it IM, IV, what exactly? It should also state the storage conditions and the expiry date, the name of the manufacturer and distributor. هذا في الليبل. اللوت number أو الباتش number. Okay, والbatch or lot number is the one that will allow me to track back the manufacturing history of this batch or this lot. If the preparation is for the purpose of dialysis, hemofiltration, or irrigation, it should be labeled not intended for use by IV infusion. Now, this label should not cover the whole body of the container because it should allow you to do, as I said, the inspection. For storage, if the injection is containing a normal chemical drug, then it usually can be stored at room temperature. But if we are talking about biological products زي مثلا insulin injections, vaccines, toxoids, etc., then usually it should be stored under refrigeration. Now we talked about single dose containers and multiple dose container. Now we will talk about injections, and they are classified as small volume and large volume. For small volume, it's up to 100 ml. This is the maximum, and we call it small volume parenterals. There are ready to use parenteral products, but usually from the manufacturer is already preparing them and they are supplied and they are ready to use. But the thing is, and the problem, that they may require thawing. Usually they are kept in the refrigerator, okay, and then you need to warm them up before use, or at least increase their temperature. For pediatric population and neonatal population, these are not small volume parenterals ready to use, are not very valuable because usually neonatal and pediatric population they require special. Every neonate or every child will have special needs, not like adults. So they have special need for fluid, special needs for nutrients, special needs for drug. You cannot just give them similar to adults. But the good thing is there are some preparations that you may dilute with a suitable vehicle to make them suitable for a given child or a given infant. Okay, يعني بيكونوا concentrated preparation, and what you do dilution according to the infant or child requirement. We'll talk a little bit about insulin, and then we'll stop this part. طبعا insulin, as you are aware, is one of the very important drug products, biologic drug products, and the common way of administering insulin is through injection needle يعني. Okay, but you should be aware that there are pen device. Pen device, it doesn't mean it's not needle. There is needle. Okay, شوفوا هنا بيكون في needle. We have also jet injector, we have pumps, we have insulin inhaler. شوفوا, this is syringe. This is the pen, is the more common one. This is commonly used. هو البن أكثر شيء. You will see it. Okay, في عنا jet injector, what you see here. وفي عنا البامبس, insulin pumps. Okay. وفي عنا الانهيليشن that the first one approved was in 2006 and the second one in 2014, but unfortunately they are not gaining popularity. The problem is they are not as efficient as the injections like the pen device. Okay, do you remember what is the gauge number for insulin needles? Do you remember? It's from 25 to 30. Now you will notice that the packaging of insulin should have a clear marking and clear letters. The lettering should be clear to allow the patient to identify the prescribed insulin product, because there are many now, there are many insulin products. Okay, and you don't want the patient to get confused with which product the patient should be using. And don't forget that usually diabetic patients will be accompanied by visual impairment or visual problems. So that's why the lettering should be very clear and easily identified. Another thing, the insulin that we give, okay, we give the patient, should usually be of two forms. One is intermediate or long acting insulin, okay, and the other one is rapid or short acting insulin. So we are giving these two types. The intermediate and long is to provide the basal continuous insulin secretion throughout the day, and they constitute 50% of person daily requirement. Okay, أما we give rapid or short acting insulin to mimic the bolus insulin or the insulin surge that comes postprandial after eating. You know, glucose goes up, so the pancreas will secrete insulin like a surge. Okay, and in order to deal with that, we need rapid or short acting insulin to mimic that. Okay, but for basal continuous insulin, we can use intermediate or long acting insulin to release insulin over the whole day or half a day. uh, Another thing is you should be aware of اللي هو HbA1c or hemoglobin A1c. This is used for the diagnosis of diabetes, other than اللي هو الفاستنج جلوكوز blood glucose level والrandom glucose blood level. This is another one. This is cumulative. It shows how the blood sugar was during the last 3 months. What is the average glucose level? Okay, and if it is 6.5 and above, then the person has diabetes. Normally, most patients will not need more than 60 to 70 unit. انتبهوا هون، مش مليجرام or anything. I'm talking about unit because unit is an activity. Okay. في الانسولين we have different types of insulin. What we are really concerned about, or we are really interested in, is what is the activity of insulin, how much it can do. Okay, and this is measured by units. You should be also aware of symptoms of hypoglycemia, such as sweating, shaking, nausea, headache, difficulty concentrations, symptoms of hyperglycemia such as polyuria, polydipsia, polyphagia, nocturnal ليلي يعني, at night, enuresis, impaired vision, altered blurred vision. Okay, blurry your vision when the glucose is high up, and there is alteration in the mental status. You should also be aware if the preparation should appear clear or it should be uniformly cloudy. Okay, because if something that should be clear and it's showing that it's uniformly cloudy, then you should ish throw it right away. Okay, I know this is a long topic, but I hope you benefited. Thank you very much for watching and have a nice day.